I'm John Higenbottam, as Bill mentioned. I'm the co-chair of the Canadian Alliance Mental Illness Mental Health. We're the major organization of alliance of mental health organizations in the country. We presently have 19 member organizations, and we're probably best known because we put on Mental Illness Awareness Week every year. So I'm going to start off the discussion today by providing you with some context, really, on mental health, chronic disease, and suicide prevention. Mental illness in Canada. Mental illness is responsible for enormous personal, social, and economic costs in this country. Just to give you some statistics, 20% of Canadians are living with mental illness right at this point in time, and 43% of us will experience mental illness sometime during our lifetime. All of us have had friends, family members, or colleagues who are living with mental illness. It's affecting everyone in Canada in some way or other. The cost of mental illness to the Canadian economy is absolutely staggering. It's estimated to be at least $50 billion per year, and that doesn't include all the related costs of lost productivity and due to mental illness. It's a major cause of short and long-term disability in Canada and accounts for 30% of disability claims and 70% of the total costs of disability claims in Canada. Next slide, please. Just wanted to briefly discuss the relationship between mental illness and chronic disease. Mental illnesses such as schizophrenia and mood or anxiety disorders may become chronic with people developing a long-term pattern. Also, mental illnesses may develop in association with chronic physical illnesses. For example, people with chronic physical illnesses experience depression and anxiety at twice the rate of the general population. And people who have concurrent mental and physical illnesses have diminished quality of life. This leads to more chronic illness and worse health outcomes. Also, people with serious mental illness face a greater risk of developing chronic physical conditions compared to the general population, such conditions as diabetes, heart and respiratory disease. Next slide, please. Suicide prevention. So, as everyone, I think, realizes, suicide is a major risk factor with mental illness, and studies indicate that more than 90% of suicide victims have a diagnosable psychiatric illness. Suicide is the most common cause of death for people with schizophrenia. We often think of suicide as being associated with mood disorders, but it's actually the most common cause of death for people with schizophrenia. People with mood disorders are also at a particularly high risk of suicide, and this accounts for 15 to 25% of the deaths by suicide. So the assessment of suicide risk and prevention should be given the highest priority when we're working with people living with mental illness. Next, please. Now, suicide is also a major risk with chronic physical diseases as well. A study done in the UK, for example, has shown that approximately 10% of people with chronic physical disease will commit suicide. And this study also concluded that the actual percentage is likely to be quite higher, significantly higher than that, because this link is being underreported. There's also an increased risk of suicide when people with serious physical illness, such as motor neuron disease like ALS, also develop mental illness, such as depression. This significantly increases their risk of suicide. So there is a list